Do you have fibromyalgia risk? About 5 million Americans live with fibromyalgia, most of whom are females. And while the root causes of the disease have still not been recognized obviously, some study has shown how pain is experienced by individuals with fibromyalgia that can assist clarify who is most likely to create it. The symptoms of fibromyalgia are due to dysfunction as well as the treatment of pain in the brain. The rheumatologist Chad S. Boomershine, MD, PhD, assistant professor in rheumatology and immunology at the Vanderbilt University and University, explained fibromyalgia patients showed reduced concentrations of brain chemicals that prevent pain signs including serotonin, norepinephrine, and greater concentrations of brain chemicals causes pain indications including P-N-glutamate. These symptoms can explain why individuals with fibromyalgia a painful effect on their skin's temperature, light, and stress have, while others do not. The deficient stress response that seems to characterize fibromyalgia is another avenue of exploration. Researchers examine how individuals with fibromyalgia and other aspects of health, such as blood pressure difficulties, treat the stress hormone cortisol differently. In addition to many other circumstances, fibromyalgia may happen. The diagnosis is difficult to achieve and patients may be confused whether one disease is responsible for another or whether they are both associated with overlap symptoms such as troubled sleep. About fibromyalgia, ask from your doctor. Terms frequently associated with fibromyalgia include mood disorders, depression, rheumatoid arthritis, insomnia, osteoarthritis, stress, lupus, irritable bowel syndrome, polymyalgia, temporomandibular joint disorder. Researchers know that they are more at risk for developing fibromyalgia if you have one or more of these conditions, even if chemicals are not yet fully understood. Main causes and risks of fibromyalgia. Fibromyalgia occurs for many individuals because of a perfect storm of variables. No single known cause of fibromyalgia is found. Risk variables include genes for the development of fibromyalgia. Genetics. Researchers have noted for a lengthy time that fibromyalgia is common in households. There is a confirmation of a genetic danger recently conducted research. These genetic variations influence ordinary brain pain signage regulation and are believed to account for the variation in the general population's pain sensitivity, said Dr. Boomershine. The extreme end of this variation is more susceptible than others to environmental stimuli, which can lead to fibromyalgia. Sexuality. The precise cause for this gender difference is not fully developed, though, females are much more probable to develop fibromyalgia, almost 90% of fibromyalgia are females. Age. There is a somewhat greater risk of fibromyalgia being diagnosed as you get older. Most individuals between 20 and 50 years of age are diagnosed. It is believed that between 3 and 6% of the global population have fibromyalgia, although close to 8% of those aged 80 are affected by it. Trauma. You may be at risk for fibromyalgia if you are already genetically predisposed to intense mental or physical trauma. Sleep stress. People with fibromyalgia often have sleeping difficulties. These issues in sleep can lead to tiredness and pain in fibromyalgia. Sleep and chronic pain can be a fatal cycle, each worsening. Physical stress. Repeated, hard physical movements such as manual labor risk chronic pain and fibromyalgia. Symptoms are presented. Work on the heat, squat for lengthy periods, more than 15 minutes, and pull heavy weights up the list of potential triggers. Emotional stress. You run an enhanced danger of developing extensive pain such as fibromyalgia if you are in a position where you do not feel backed by colleagues or your work is monotonous. Research also indicates that individuals with a usually negative mood have worse pain. Stay healthy. Thank you for watching this. Please do not forget to subscribe, share and like our channel. Click the bell icon for latest updates.